Yeah, great. So I suppose originally my background, I'm a physiotherapist, and I would have worked clinically as well as doing research. And I suppose sometimes I felt a bit frustrated in clinical practice that often best practice evidence or research isn't maybe being put into practice as much as we would like it to be. And I suppose also then coming from the research side of it, where there's a lot of resources and efforts put into developing really great interventions and that type of work. But again, often maybe it's not carried out maybe as well as it could have been, or we get to the end of a trial and the results, we have them, but they might be not effective, or we think why wasn't it, but we don't really know about the kind of interim bit, so what happened say between the development and the outcome of it. So I suppose coming from that kind of dual background really would have sparked my interest in it. And then I started my PhD in University College Dublin in 2013, and I was lucky to be working as part of a big randomised controlled trial, well, feasibility trial, to do with self-management for people with low back pain and osteoarthritis. So that was kind of behaviour change interventions. And I kind of chose to look really at the implementation fidelity of that project. So essentially what we designed to happen, would that actually get rolled out into practice, and would it be put into practice the way we wanted it to be and the way we intended it to be? So that's kind of where it came from originally. And at the moment my postdoc research in the Health Behaviour Change Research Group in the National University of Ireland in Galway is to do with, so it's basically on a more of a public health project with the Health Research Board, the HRB in Ireland. They have funded 3 ICE post-doctoral fellowships, which are interdisciplinary capacity enhancement fellowships. And essentially there's 3 of us who are working on this particular project within childhood obesity. And essentially we're trying to develop an infant feeding intervention. So essentially an intervention to promote healthy infant feeding practices with the overall goal of contributing to the prevention of childhood obesity in Ireland. And I suppose my particular kind of interest and focus within this project is actually looking at, say, the transparency of the process of that intervention. So when we have developed our intervention, will it run the way we intended it to? In terms of, I suppose, will it be delivered the way we want it to? Will people engage with it the way we intend them to? So kind of looking at that process, as I said, between the development and the outcomes, and what happens in that kind of interim stage. Yeah, massively so. And I mean, that's really the thing with behaviour change interventions, is that you're dealing with people, and people are so complex. And then you also might be getting, say, a physiotherapist or a healthcare provider or a psychologist to deliver an intervention. So you're again dealing with a person at the provider level, and then also a person at the patient or the recipient level. So there's 2 instantly really complex aspects to it. And also then if you're running maybe a cluster trial, you're working in different settings or sites. And then when you're looking to maybe go to scale up or disseminate, again, you're looking at maybe lots of different contexts and again, the setting. So yeah, it's a really complex, I suppose, issue. And in general, I think there's been a lot of great work done in recent years. I suppose a couple of the names that come to mind for me would be Susan Mickey in University College London, and also our own director of the Health Behaviour Change Research Group, Dr. Molly Byrne in Galway, to really try and focus on trying to make those behaviour change interventions a little bit more scientific, so that we can specify what are the active ingredients that make the behaviour changes interventions work or not work. So trying to specify, is it this goal-setting approach? Is this the crux of it? Is this the bit that needs to be reproduced? Or is that actually not the bit that works in the end? So I suppose it's kind of, I'm looking away in that, like the last while, I think there's definitely been an increasing focus on trying to make them more transparent and more, I suppose, reproducible, replicable in other settings. And I suppose for me, the fidelity work that I've done for me has really highlighted the importance of this, in that if we really know what has actually happened right back to the training of the provider. If we know how well that training was run, was it standardized, what that training involved, did the providers actually then get what they needed from that training? To the delivery, did that actually get delivered as we intended? We can really then tell, what is the most important elements of the intervention to roll out, or how can we replicate this in other settings? If we really do know what's happened in one setting, it'll make us a little bit more able to reproduce successful interventions. And then on the flip side, if we've tested the fidelity kind of across the whole intervention procedure, we can tell maybe why something wasn't effective, or for who it wasn't effective, or for who it was, for whom maybe. And that kind of would be the whole process evaluation side. So we're trying to evaluate that process of the intervention, and that's really where my kind of interests would lie with it. Yeah, I think there's definitely a bit of both. I think it's very much, I think there definitely is a real openness to this whole idea of making things more reproducible, transparent, and all that. I also think that there is not an argument, or maybe an argument, or some kind of other slightly different viewpoints in that we have to be careful about manualizing things too specifically, because it is individuals and it is people that we're dealing with, and not every one person is the same. So that's kind of the flip side of it. And there would be, quite a big debate between fidelity and adaptation, especially then when you go into disseminating work and rolling it out into all those different contexts and settings. So that has been kind of, definitely something that's come up a good few times. Also, I suppose, when you're doing research more on kind of methods, so a lot of my stuff is not maybe a specific area, but it's the methods that I'm quite interested in. How you assess fidelity, how you assess the process. Sometimes it can be a little bit harder to kind of get maybe like a methods paper published, as opposed to like an outcome results kind of paper. So that can be a bit tricky sometimes. And also it's quite complex as well. It's like fidelity and implementation science, I think, is kind of an emerging field, which is really exciting. But also then your head can get a little bit fried sometimes, because you don't know, if you're doing the right thing, or if you're saying the right thing, or thinking about something the right way. But I think it's all like a learning process, and I think it's evolving and changing for the better, I hope. I think because it is growing, really. I can't remember when the Implementation Science Journal was created, but it was, I think, recent enough, last 10 years or something maybe. So, having a journal dedicated to this type of work, I think it's really exciting. I definitely think the push to, I suppose, trying to make those behaviour change interventions more scientific is really exciting. The idea that, I suppose, coming originally into this, I wasn't sure if I could maybe kind of carve out a direction for myself that kind of would be methods related. I suppose years ago I thought getting into research immediately in the first place, I'd have to pick like a specific area or a topic, or a specific disease or whatever. But the knowledge that actually you can be like a methods person, or you could be predominantly interested in that type of stuff is quite exciting and interesting as well. I think the work that they've done here as well is really fascinating and fantastic, and it's great for me to come here to see so many different kind of areas and different types of research, and I'm learning loads. And I think just even because something that did come up was people saying that the publication or perish. I think Professor Lorena Barber said that. That publish or perish climate that we're in. And, obviously that's a challenge, that you're trying to publish lots of papers, and if it's methods papers that people mightn't be as interested in, that can be difficult. But I think on the flip side then there's an opportunity for us to kind of actually publish the development of our interventions, and publish the training of our providers, and publish the fidelity of what we deliver. So I think that's a way of you know, using that publish or perish where you need more papers, well, why don't we just publish our transparency processes? And, you know, that can be an opportunity, I think. So